Throughout the COVID-19 pandemic, terms like food insecurity and hunger have increasingly circulated in public media and become integrated into our lexicon. And it is true, COVID-19 has resulted in an increase in food insecurity, exacerbating existing racial and ethnic disparities. And even though some temporary pandemic provisions, like the federal expansion of the Supplemental Nutrition Assistance Program, or SNAP, alleviated some of the burden that food insecure families have faced and are facing, participation in these critical programs remains quite low. But we don't often talk about why. It's possible that discrimination, like racism, xenophobia, or the overall stigma surrounding social assistance use in this country, is actually deterring participation. And so I've taken survey data out of a study from the University of Michigan to better understand food insecure families' experiences of discrimination in 3 Michigan cities. And what I've found so far is that over a third of participants are reporting some kind of discrimination, whether that's judgment because they use food assistance or concern about future mistreatment. But they've also described a pervasive sense of social stigma surrounding their use of these services. And for some participants, particularly Black women, discrimination is deeply intersectional, producing uniquely damaging experiences as they seek out these programs. But this research really challenges a story that we like to tell in this country. The classic story of meritocracy. We insist that if you just work hard, you can achieve anything, economic or otherwise. Unfortunately, this is a myth for most people in this country and a reality for a select few with the racial privilege and resources to maintain or achieve economic mobility. My research exposes families' realities of working 2 jobs, still with insufficient funds to put food on the table at the end of the day, as well as the gaping holes in our so-called social safety net. But the participants in this study have shown us that we have to reimagine how we think, frame, and talk about food insecurity in the United States. We have to center empathy instead of punishing individuals and families for conditions that are beyond their control. And so this means shedding the myth of meritocracy, reckoning with the judgment and racism that families are subject to, and using their voices and lived experiences to chart a path forward. And the participants in this study have called for things like expanding SNAP to include more individuals and removing some of the bureaucratic barriers like excessive paperwork and long wait times that sometimes impede their ability to access programs. But they have also called for things like livable wages so that they don't have to choose between rent, electricity, and food at the end of every month. And so if we really want to address food insecurity and hunger in this country, an issue that has plagued us for generations, we have to move beyond just talking about food access. We have to start to talk about systemic change that will address the root causes of food insecurity. Thank you.